I was interested in how the human body works, and also, I would say in a human way, very interested in being able to apply what I know and what I can do to trying to help people. That fits into, I think, it may sound hokey, but how I was raised and how I grew up, and is one of the things that still gives me a lot of meaning in what I do today. Someone sees me at an initial visit, they're coming either after a biopsy has been performed to make a diagnosis through a primary provider, perhaps a surgeon, or in some cases they've been under the care of another oncologist and they're being referred for a second opinion or for help in managing their care. I spend a lot of time talking with patients at that first visit about the diagnosis that they have, about how it works, about what to expect within the limits of our ability to tell them about what they can expect to happen in the future. When someone becomes one of my patients, they're usually my patient for life. And developing and nurturing and maintaining those relationships over time is one of the real big rewards. We know that when many people go to see a doctor for anything, and especially when someone comes to see a doctor with a cancer diagnosis, that anxiety and fear are some of the strongest things that they feel at that moment. And whatever I can do to alleviate some of that by giving them information, by just being present and giving them a chance to share some of what's going through their mind and their heart, that's really meaningful to me. And sometimes it means that I'm not the most punctual guy in the clinic, but allowing people to get that out of an interaction when they're with me in an office visit is something that I think is worth a few extra minutes and makes a big difference in what they're going through. For the past couple of years, cycling has been a big thing. I had done that a pretty long time ago and then stopped for a while, and then because of our Velasano cycling fundraiser, I started riding again in the summer last year.